All right, so let's talk a little bit about toxicology and get you set up for this next module. We'll probably spend a couple of weeks on it, primarily because there's so much information that needs to be covered within it. So let's start some definitions. Well, basically, a poisoning is any substance that impairs health or causes death by its chemical action when it's introduced into the body. Now, the thing that's important to keep in mind is that this definition is not limited to illegal drugs or industrial chemicals. This could be common medications, household items, plants, or gases. The key phrase here is chemical action. Keep in mind that poisons interact at the cellular level, altering metabolism, damaging tissues, or disrupting vital physiological processes. Now, I want to emphasize, if it causes harm by altering the body's normal chemistry, it's a poison. Now, let's talk a little bit about how poisons enter the body. Basically, we're looking at 4 different routes of exposure that every paramedic must consider. The first one we'll look at is ingestion, and this is the most common route. Now, this can be accidental, intentional, or environmental. So, for example, you can have a Tylenol overdose that leads to liver toxicity. Now, one of the key risks in any type of an ingestion type of incident is the time to symptoms varies based on the substance as well as the dose. So this is another one of those areas in which time is of the essence of you're having to balance finding out what they took, how much they took, as well as not delaying getting them into definitive care. This does not mean that we're just simply going to throw them on a stretcher and go to the hospital. But again, you got to weigh all of those variables out. Second route, inhalation. With inhalation, we get rapid absorption through the alveolar surfaces into the bloodstream. For an example, you can have carbon monoxide that displaces oxygen on hemoglobin. Now, it's an incredibly fast onset, and often respiratory compromise is the first sign that you'll see on these patients. One of the things to keep in mind is because of the principle of diffusion meaning a gas diffuses from a higher concentration to a lower concentration until they equalize, and because of how quickly that happens within the alveoli, patients that inhale toxic substances can often have an onset of action almost as fast as if that medication had been given IV in other situations. Speaking of IVs, injection. With injection, we see through like IV drug use, IM injection, or even envenomation from snakes or other types of insects. A good example of this is one that we face today. Opioid IV use causing immediate central nervous system depression or potentially snake venom rapidly entering the circulation. Last one we're going to look at here is going to be absorption. This goes through the skin or the mucous membranes. So, for example, we know that organophosphate insecticides are absorbed through the skin, causing a cholinergic battle within the body. Now, it's often overlooked through this route, but it's important, especially when we're dealing with hazmat incidences or occupational exposures, particularly within industrial areas and or agricultural areas. Now, one of the most important concepts in toxicology is known as the Paracelsian principle. That is that the dose makes the poison. Now, keep in mind that if you drink enough water, water becomes toxic. Okay, oxygen at high concentrations and pressures can become toxic. We know that from cardiology of now we no longer give oxygen out to every single patient. Small amounts of cyanide are deadly, while you can have large amounts of certain medications that are tolerated daily. Now, one of the key takeaways that I want you to remember here is that don't dismiss a substance because it's, quote, safe at normal levels. What matters is the dose and the route. And the other thing to kind of keep in mind here, guys, is that Same dose can affect people differently based on age, weight, metabolism, and underlying conditions, especially those who have hepatic or renal failure issues. As advanced providers, our job is not just to recognize the poison, but to recognize how dose and route could potentially have turned a therapeutic substance into a life-threatening emergency. So as we're kind of summing up on this particular area here, poisoning is a chemical assault on the body. And we have to constantly think in terms of what, how, and how much. What substance? How did it enter? And how much is too much for this patient? In the next few slides, we'll talk about moving from definitions to recognizing patterns, those classic toxidromes, and applying field management principles that can save lives. Toxidromes is a term that every paramedic should know. They're classic symptom clusters that, when recognized, allow you to rapidly narrow down the type of poison or overdose that you're dealing with, even if the patient or the bystanders cannot give you a clear history, which is quite often. Knowing these clusters of symptoms and these clusters of onsets can mean the difference between early appropriate intervention or just taking a hunch and basically guessing in the dark. First up are anticholinergic toxidrome caused by medications like antihistamines, tricyclic antidepressants that we also call TCAs, and certain plants such as deadly nightshade. Signs and symptoms that we will see for these patients will be, first of all, hot and flushed skin. You've heard the little rhyme that they're red as a beet, and they will look very, very red, and their skin will be very, very hot. I also have dry skin and mucous membrane. This is kind of comes into play here with the part of it that says dry as a bone. Especially look within the mucous membranes because you're going to get a lot more early information because those are going to have a tendency to dry out much quicker than the skin. And so you can see that dull pink color that's occurring there as they begin to dry out. Mydriasis, dilated pupils, blind as a bat. These folks will have much difficulty in being able to really kind of focus on things around, and the light around them will probably be causing them some difficulties as well. Because remember, their pupils are dilated, letting more light in. If you've been to the optometrist and had your eyes dilated, you know how uncomfortable that can be. And then they can suffer delirium or hallucinations. That's where the mad as a hatter comes from. Basically, what we're looking at here is red as a beet, dry as a bone, blind as a bat, and mad as a hatter. Hatter referring back to some of the toxic chemicals that people that made hats during the 1800s when top hats and fur hats were just a really high popular thing, especially amongst the wealthy. Some of the chemicals used to cure that would lead into anticholinergic syndrome. Now, your classic field presentation is going to be a confused and agitated patient who's going to have a really fast heart rate. They're going to be extremely hot to the touch. Their mouth is going to be incredibly dry. And when you look at their pupils, they're going to be completely blown. Sometimes the pupil is completely blown and you don't see any part of the pupil whatsoever. So how do we manage these folks? Well, first of all, cool them. All right, so get ice packs on them, use a misting fan, soak them down with cool water because we got to get that body temperature down. Remember, when the body temperature goes up for an adult, they do not handle that very well, and we can literally have, for lack of a better term, having the brain stewing in its own juices. Don't be afraid to give benzos for agitation and seizure prevention. Sometimes these patients are going to be really obstinate. They will be argumentative, and they can become combative. And again, those are the two things we wanted to look at. Is we want to make sure that we protect ourselves, we protect the patient, and we also protect our partner. So again, if you need to, look at giving benzos. Now, within this particular module, we're going to be looking and doing some review on medications that you would give for specific different types of toxidromes as well as specific types of overdoses. Get your patient on a cardiac monitor. TCAs, tricyclic antidepressants, can really lead into some serious dysrhythmias as that QT interval begins to spread out and get longer and longer and longer. We greatly increase the chances now of having R-on-T phenomenon. Now, if you'll remember back to 303, when I lectured about R-on-T, I said most of the time when we have immediate defibrillation, these patients react really, really well to R-on-T. Not so much when we've got anticholinergic overdoses, because now that widened QT interval is being caused by a chemical, a drug. And so it's difficult for us to offset that and to prevent it from happening. Now, expert tip here is, now, these patients look like that they may be on a sympathomimetic overdose, such as cocaine, crack, things along that line, meth. But the key difference, basically, with these guys, they have extremely dry skin and absent sweating. This can be deadly to our patients quickly. Sympathomimetic patients will sweat profusely. Don't get them mistaken.